Welcome to Beyond the Data. I'm Dr. Phoebe Thorpe, here to talk about adolescent health. And with me today is Dr. Stephanie Zaza, the Director of the Division of Adolescent and School Health. Stephanie, thank you so much for joining us.
Sure, thanks for having me.
Yeah, this is a very exciting session of Public Health Grand Rounds about adolescents, teenagers. Everybody knows that teenagers and adolescents change, evolve. It can be day to day, it seems like forever, and then they get through it. What is it about that time period in people's lives that is so important for us to focus on from a public health point of view?
Well, I'm glad you asked. It's a really profound time of change. Lots going on for these young people, and there's natural risk-taking that has to happen for them to grow and mature. And that's why it's so important that we pay attention. This is the time when all kinds of new behaviors are being tried out, tested, if you will, and they're learning from those. And so if we can really encourage healthy habits and try to, as much as possible, reduce the risky habits that they could be forming, it does two things. First, it prevents problems right now when they're kids. So, for example, reducing risk behaviors right now. But that it also sets up new habits for a lifetime so that they'll have healthy nutrition, for example, throughout their whole life if they're learning how to do that now. It's a very important time because they're learning so much so fast.
And it's the habits now that they form that they carry through into adulthood and the rest of their life.
Exactly.
Sure. So can you tell me some about the risks that we're concerned about that adolescents take? Everybody knows the ones about like texting and thing, but what are some of the other ones?
Well, I think you raise a really important one. You know, 10 years ago, we didn't have to even ask the question, have you ever texted and while you were driving? We ask that question now, and a very disturbing number of young people admit that they text while they're driving or use the phone. And so that's a really important new risk. We're also seeing some emerging things like the use of e-cigarettes or other vapor products, which we didn't really have as a risk before. So the things that are ongoing, though, I think injury risks are huge. So bicycle helmets, learning safe driving habits, for example, those are really important during this time. And then the other set of habits, there are several, using substances, alcohol, tobacco, and other drugs, very important. If young people don't start in this time of life, they often won't ever. So really trying to avoid some of these very risky behaviors in adolescence can be very important. And then the third area that I think I'd focus on is sexual risk. This is a normal time. This is puberty, sexual maturation. It's unique to adolescence. And again, this is how young people have to learn how to manage these new feelings and new bodies that they're inhabiting. And so helping them through that time to understand how to be safe with their sexual habits, how to hopefully delay sexual initiation until they're really ready, and then once they do, to be safe in their habits with a smaller number of partners, with using condoms, using contraception, really helping them learn what those things are for a lifetime.
Yeah, and that sounds really kind of like the interventions that you're talking about are both looking at risks that they're taking, but also addressing or looking at the good behaviors that they have, either we're wanting them to take or that they're already doing. And I have, through working this session with you, I have heard more about how the focus is also not only kind of don't do that, but also, hey, you're doing this well. Can you tell us some about that shift in the concept of adolescence?
Really, really important area. So we call them, we often talk about risk factors, but what we want to also focus on, and maybe want to focus on even more, are what we call protective factors, things that really help young people, things like youth development, parent engagement. There's almost nothing more important than the parent relationship with the young person, constant conversations, and knowing that the parent is there. These are important. Connectedness to the school can be very important for young people, so that sense of belonging and having safe places within that school. So for kids who feel like they're maybe excluded from some things or bullied, to find allies and to find places where they know teachers and to know that the school supports them. So these kind of protective factors are really important for young people as well. Not just focusing on the, sort of the scolding, don't do that kind of,
but providing
that nurturing and that youth development, giving young people responsibility for their health and sort of setting that expectation, but giving them the tools to do it, the skills and the knowledge to do that.
That's a very good example of it, because when you were saying, I was thinking of, you had mentioned that as children go into adolescence, that one of the things as clinicians that we can do is try to encourage them to have alone time with the physician while they're there for their visits. That's an example of what a clinician or an individual could do. There's also more about what communities can do. And can you tell us a little bit about how the interventions run that whole gamut of individual or clinician to community, and where that's going?
So, we've talked a lot about young people and working with them individually. We also look at things like health education and physical education in school. So the schools can do lots of things. Clinicians have a very important role. So they provide a lot of anticipatory guidance. They're actually providing some of that health education, if you will, in that setting. They're also teaching, in the nature of that relationship, a young person how to be a good healthcare consumer, how to take care of, how to seek information and services when they need them. Very, very important. And it's important for parents to understand why that needs to happen, so that they will either absent themselves from the visit or allow that to happen, so that the young person can learn how to engage with their physician. And then in the community, I think it's very important that we think about the whole community is supporting adolescents, their families, making sure all those pieces are fitting together. So we think about, for example, the school can't do everything, but the school can have good connections to clinical services or other health services in the community and help the adolescent actually activate those services and get to those services. That's important. Having good transportation to those services. And then once the young person arrives there, that those services are teen friendly, that they understand how teenagers think and work and feel and what they need, so that when the teenager gets to that place, they feel comfortable and confident and able to use that service.
Yeah. So, and we talk about a lot of different interventions in the session. And they're like here and there, and they're great examples. But I would really like to know, what's the next step? How can we go from here and there to beyond, to what can we do to make it bigger? And also, like, the whole child, it sounds like it's like everywhere we need to kind of work.
I think the most important thing we need to do first is to set adolescence, the stage of adolescence, as a priority. So we do a really good job with early childhood, for example, lots of energy, lots of attention to early childhood development, early childhood education, vaccines in childhood. And then we sort of expect our adolescents to kind of go it on their own.
They're almost there.
They're almost there, almost adults, but they're not mini adults. They are in a very unique developmental stage. And so first, I think, as communities, we have to prioritize acting during this time to help nurture that development, that very specific developmental stage. I think that's the first thing we have to do, because you can't scale up these interventions to create a community unless you're actually setting that as a priority. So that's the first thing. Not that you want to take anything away from the early childhood piece at all, but we also have to not ignore the adolescent time. And then we have to have, at a community level, policies in place that support the kind of interventions that need to happen. So you have to have policies that support health education in the school, so a school district policy, for example. And you have to have policies in the community that can create a safe environment. Policies like bike trails and crosswalks, and so it's sort of again, it's a whole community that is, the school is part of the community, the families are part of the community, so really bringing that all together
is important. Yeah.
Yep.
Thank you so much for coming today and for putting on this session. It's very, very important.
Thank you.
Very important to our adolescents and to their futures.
Thank you.
And thank you for joining us. See you next time for Beyond the Data.